I'll turn it over just quickly to Dr. Barber to lay a little bit of an outline for what we're going to do in these interactive role plays. We're going to do what we call freeze frame, and she'll walk you through some steps. And I am going to have the great honor to have my dreams come true and let Dr. Barber be my actual therapist in these sessions so that we can really demonstrate to you what this looks like live.
What we're going to do today is do some clinical role plays. And as I said earlier, we thought we would focus in on some of the kinds of conversations that aren't the straightforward ones. When we see progress, that's great. And that's really easy to talk about, but we're not always going to see progress. So we thought today we would show you a couple different kinds of scenarios that can come up. For the first example, we're going to be focusing on the measure that you see in front of you. This is just a few items from the measure called the Mental Health Recovery Measure 10. It's a briefer version of the longer mental health recovery measure. And this is a measure that assesses clients' perceptions of their progress while they're dealing with some kind of chronic or persistent mental health diagnosis. And so it's a very recovery-oriented measure consistent with its name. And we thought it would be great to highlight using a measure that's not a symptom-focused measure for some of our role plays today. So for our role plays today, we can assume that Amber is the same patient across all of the examples, and we'll be working on, a role play where we're treating depression. Obviously, Amber is very complex, so we will not pretend that depression is the end-all be-all of what she's experiencing, but that can be our basic frame for these role plays. So
I'm very complex. We don't even have to role play that one. And in between each one of these, we're going to try to slice out for you all three different aspects of how Dr. Barber might address this with the particular client. So when that happens, we'll say freeze frame, and then we will step back into our selves and we'll kind of walk you through a little bit about what we worked on there, and then jump back into the next segment of the role play.